STRENSIQ, asfotase alpha, indication and important safety information, including boxed warning. Indication. What is STRENSIQ? STRENSIQ is a prescription medicine used to treat people with perinatal, infantile, and juvenile onset hypophosphatasia, HPP. Important safety information. What is the most important information I should know about STRENSIQ? STRENSIQ may cause serious side effects, including severe allergic hypersensitivity reactions. Allergic reactions are common with STRENSIQ treatment and can be severe and life-threatening. Severe allergic reactions have happened in some people within minutes after receiving STRENSIQ and more than 1 year after starting treatment with STRENSIQ. Stop using STRENSIQ and go to the nearest hospital emergency room right away if you or your loved one get any of the following signs and symptoms of a serious allergic reaction: difficulty breathing, choking sensation, swelling of your eyes, lips, or tongue, dizziness, nausea or vomiting, fever, headache, sweating, feeling irritable, chills, skin redness, skin rash or hives, itching or numbness of the tongue, lips, cheeks, or gums.
My oldest son was very sick when he was first born, and they had sent us to all kinds of medical facilities to figure out what was going on, and he was diagnosed with hypophosphatasia. I think the hardest part for me was not letting him be a kid, because you had to protect him from breaking bones or, just the normal things kids want to do. There really was no course of treatment up until he was a teenager. When it was all FDA approved, that's when we started taking STRENSIQ. I would say within a few months that you could see him doing things a little easier than what he was doing them before. The biggest change I can tell in him, he doesn't have near the pain, and so you can tell that life has gotten better for him after STRENSIQ. He's done very well. I actually had issues from birth. In my younger years, tremendous amount of pain, stay up all night, just horrible. Then they decided I think I was 13, they said that I had genetic bone deterioration disease and I'd be in a wheelchair by the time I hit my senior year. When I found out that I could have hypophosphatasia, I was actually at a convention with my son as a caretaker. One of the speakers said, "I'd like to know your history." And I said, "I'm the caretaker. I'm here with my son, he's got hypophosphatasia. But we want to know your history." It blew my mind that had never crossed my mind before that I could have hypophosphatasia, because I'd put everything to my son, I was really fast diagnosed through the blood work and genetics was having hypophosphatasia. He was doing so good on STRENSIQ that I said, let's get the ball rolling. Once I was diagnosed, I would say a couple months of starting STRENSIQ, I was able to do the activities that I enjoyed and that I've been missing out on for years. I was the caretaker for my son when he was young, so I was the shot giver, injection giver, of STRENSIQ for him. One of the biggest side effects that they have you watch for is after injection is the sight. Swelling, redness, tenderness, burning. I think everybody's experience is different. I'm absolutely thankful for STRENSIQ. I mean, it gave me life back. It gave me, I'm able to do what I wasn't able to do for years, but I also try to ensure that I don't overdo it and I listen to my body.
What are the other possible side effects of STRENSIQ? STRENSIQ may cause other serious side effects, including skin thickening or pits at the injection site, lipodystrophy. Lipodystrophy is common and has happened after several months in people treated with STRENSIQ. Calcium buildup in the eyes and kidneys. People with HPP are at increased risk for developing calcium buildup in the body. Calcium buildup in the eyes and kidneys has happened and is a common side effect of STRENSIQ. Calcium buildup in the eyes and kidneys may also happen in people with HPP who are not treated with STRENSIQ. Your healthcare provider should check your eyes and kidneys before and during treatment with STRENSIQ. Immune-related effects. You may develop antibodies during treatment that may decrease how well STRENSIQ works. Tell your healthcare provider right away if you get worsening symptoms of HPP, including difficulty breathing, difficulty walking, feeling tired, bone pain, stiff joints, or loss of appetite. The most common side effects of STRENSIQ include local skin injection site reactions such as skin redness, bruising, color change, pain, itching, hardening of the skin, induration, swelling, and bumps. These are not all the possible side effects of STRENSIQ. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider for medical advice about side effects. You will begin receiving STRENSIQ under the supervision of a healthcare provider. Tell your healthcare provider about all your medical conditions, including if you have had an allergic reaction to STRENSIQ, are pregnant or plan to become pregnant. It is not known if STRENSIQ will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if STRENSIQ passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you use STRENSIQ. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. There is a registry for people who use STRENSIQ. The purpose of this registry is to collect information about HPP and about what happens when you use STRENSIQ for a long time. For more information about this registry, talk with your healthcare provider or go to www.hppregistry.com. To report suspected side effects, contact Alexion Pharmaceuticals, Inc. at 1-844-259-6783 or FDA at 1-800-FDA-1088 or www.fda.gov/MedWatch. Please see full prescribing information and patient information for STRENSIQ asfotase alfa, including boxed warning regarding severe allergic hypersensitivity reactions at strensiq.com.